Walking pneumonia is a mild form of pneumonia, a lung infection that causes swelling in the airways and fills the air sacs with mucus and fluids. Unlike regular pneumonia, walking pneumonia is less severe, allowing individuals to continue daily activities without realizing they have it. This condition, also known as atypical pneumonia, doesn't usually require bed rest or hospitalization. Anyone can contract walking pneumonia, but it's more common in young children, older adults, and those with weakened immune systems or chronic respiratory conditions like asthma or chronic obstructive pulmonary disease. The symptoms of walking pneumonia often resemble those of a bad cold or flu. Early signs include a sore throat, extreme tiredness, chest pain, low-grade fever, mild chills, cough, sneezing, and headaches. Walking pneumonia can be caused by bacteria, viruses, or fungi, making it highly contagious. It spreads through tiny droplets released into the air when an infected person coughs, sneezes, talks, or breathes nearby. The contagious period can last from 2 to 4 weeks before symptoms appear, and individuals remain contagious until symptoms subside. Diagnosing walking pneumonia involves a doctor conducting a physical examination and auscultation, where they listen to the lungs using a stethoscope. They will inquire about symptoms and any recent contact with sick individuals. If walking pneumonia is suspected, further tests such as chest x-rays, mucus samples, or blood tests may be ordered to confirm the diagnosis. Blood tests involve drawing a small amount of blood from a vein, which is then analyzed in a laboratory. These tests help determine the cause of the infection and guide appropriate treatment. Treatment for walking pneumonia depends on its cause. If bacteria are responsible, healthcare providers may prescribe antibiotics such as macrolides, fluoroquinolones, or tetracyclines. It's crucial to complete the full course of antibiotics to prevent recurrence and complications. For viral or other causes, the illness must run its course, with over-the-counter medications recommended to alleviate symptoms like nasal congestion and cough. Drinking warm fluids, using a humidifier, and taking hot baths can help open airways. Non-steroidal anti-inflammatory drugs may reduce fever, but consult a doctor before use, especially if you have other health conditions. Preventing walking pneumonia involves practicing good hygiene and taking precautions in crowded environments. Cover your nose and mouth with a tissue when sneezing or coughing, and dispose of tissues properly. Wash hands regularly with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer if soap is unavailable. Wearing a mask around sick individuals is advisable, especially for those with respiratory or chronic health conditions. Avoid smoking and exposure to secondhand smoke, as it can exacerbate symptoms. While no vaccine exists for walking pneumonia, an annual flu shot can help reduce risk. The prognosis for walking pneumonia is generally positive, with most individuals recovering well with rest and appropriate treatment. Antibiotics can speed up recovery, though a lingering cough may persist for weeks or months. It's important to follow doctor recommendations and complete any prescribed medication courses. If symptoms do not improve after several days of treatment, consult a doctor for further evaluation and possible adjustment of treatment plans. Living with walking pneumonia requires careful management of symptoms and adherence to treatment plans. If symptoms persist despite treatment, seek medical advice. It's crucial to take medications as prescribed and avoid self-medicating with multiple drugs without consulting a healthcare provider. Ask questions about your condition, treatment options, and any necessary follow-up appointments. Understanding the differences between walking pneumonia and other respiratory illnesses, such as COVID-19, can help in managing your health effectively and preventing further complications. If you have found this video to be helpful, don't forget to like and subscribe to the Weekly Wellness channel with Dr. Aaron Williams.